Welcome to our ET Talks, Essential Tremor in the Brain. I want to welcome everybody. This is an important information that everybody with ET needs to listen to and learn about. I would like to welcome our co-host, Dr. Darlene Lobel, who is our DSF president, and Cher Matson, who is one of our trustees, and Dr. Drew Christensen, who is also on our medical board. It's going to be a very interesting discussion, and please, Darlene, can we leave, people leave notes, questions?
Yes, I have invited the folks, and if you're just joining, please use the chat feature or the Q&A feature, whichever one you're more comfortable with, and go ahead and put your questions in the chat so that we can answer those. And those questions can be directed medically. So I also am a neurosurgeon, and Dr. Christensen is a neurologist. And so we have that expertise as well. And
yes.
So correction, I am not a neurologist. Just so you know, I'm a family practice doc, also board certified in integrative medicine. So that's my background. But I have special interest in the alternative treatment and outlook of essential tremor. So it's one of the things I kind of specialize in, but I'm not a neurologist. Just want to make that clear.
But
Well,
you do
we
have
essential tremor.
That's right.
Yeah,
So
but I've
do.
lived with it for a long time.
Yes,
we
we
all
all
have. Yeah.
Yes. So, okay. I guess, we have the questions. Darlene, I don't know if you had pulled up any of the questions, but I've got them. So
yeah, I do, but you can go ahead. Yeah.
no, why don't you go ahead and pull them up and see, because I may have a few more.
Okay, absolutely. Well, one of the most popular questions, which we get quite frequently, is actually about new medications for essential tremor. And until recently, we haven't had a lot of information to share with you about that, but I'm happy to report that there are a number of clinical trials going on right now with a number of companies and several that are just getting ready to kick off. And I know we have presented some of those to you. So there is one through Jazz Pharmaceuticals. It is the Everest trial. These are all medicines in various stages. So there's different phases. Many of these are in phase 3, which means there's you would come in and either be randomized to one taking the experimental medication or to what's called a placebo, which is something that basically is like a sugar pill that would not do any harm to you. And then we compare the outcomes. They compare the outcomes of your tremor and also look for side effects. So it's a safety profile and efficacy, or how well it works. So that is one. Sage has a phase 2 trial ongoing, hopefully soon to be phase 3. Praxis is actually very secretly getting ready to launch something. They won't announce their sites yet. I just looked for an update on the clinical trials website, but they still haven't announced their sites, but that's coming. And there's a couple of other agents that are being studied right now, mainly drugs that are being used for other indications like epilepsy, are being studied for the treatment of essential tremor. So not new on the market yet, but very close. And I think, we're going to be seeing, as we see the results of some of these phase 3 trials, it's really encouraging that they're getting to the phase 3, which means they've passed all of the preclinical studies and the safety. They've really established a strong safety profile already for the medications. But Dr. Christensen, do you have anything you want to add to that?
No, I think some of the newer meds on the block are associated with calcium channels. And so that's one of the main areas that a lot of these companies are looking at. So it's kind of nice because it's a new category. We've got, the beta blockers, and we've got medicines that are anti-seizure meds, right? There's a
Mhm.
whole group of those that we use. So this is a new category, so it'll be kind of nice to see how that might work for people that haven't done well with some of those other meds. I know there's also a trial going on right now for cannabis and essential tremor. So that's ongoing. We don't have results that I know of yet, but that's another trial that's going on.
Isn't this the most medications that have been in the works for like ever? I don't remember us ever having info on this many at one time, and it's encouraging.
It is. It really is.
Yeah. What can you explain what a calcium channel medication does? Why calcium?
Well, calcium is really important for nerve function, and calcium channels are the channels in the cells that allow influx and efflux of calcium. So movement of calcium in and out of the cells. And that can influence how those nerves fire. And there's certain types of calcium channels, I think they're called T channels, that these medicines are focused on, and they seem to have an effect on tremor. So it'll be fun to see what those trials look like and what kind of results we get.
Interesting. I didn't know that little tidbit.
That's why I asked the question. I didn't
I
either.
know.
No, it's a good question, because it's one thing to say, yes, there's a new medicine available, but what is that medicine actually doing? I always like to know about that, and I know folks like to know what it's doing. So calcium channel blockers, just of interest too, have effects for people with heart disease. So sometimes if you have heart disease, you might be taking a calcium channel blocker. It helps to treat hypertension and some other things as well. So that might be something that, not this particular one that's currently being studied, but a similar family. So your doctors will always be looking at your other medical conditions as well, and making sure that nothing is what's called a contraindication, or a reason that you shouldn't be taking this new medication. So important to disclose all of your health issues to your physicians. So.
And that's something we need to tell everybody. You need whatever we're telling you, is the old saying, take with a grain of salt, take it to your doctor.
Yes.
And discuss. Each person is differently. So we do want to let you know that. Don't, this is a discussion about what's happening, and things are changing daily. So.
Do you guys know now when they say calcium channel blocker, and the reason I'm asking this is my husband has sarcoid, and when his calcium levels get too high, it definitely affects his brain for sure. And I wondered, does this reduce potential calcium? I mean, are they seeing any correlation between high levels of calcium in the body and needing to control that, or low levels?
No, so this would be different.
Okay.
Calcium levels in the body are really maintained generally by things like vitamin D, your parathyroid gland. Those things are really managing calcium levels in the body in general.
Okay.
These are more talking about little tiny calcium levels actually within the nerve cells, and how that has an effect on how tremor is controlled. So
Thank you.
yeah, it's a little bit different. But sometimes calcium can, in the brain, cause more excitatory functions, which can then lead to bad things in the brain, like worse tremor, but other things like headaches and things like that. So
Thank
it's
you.
a good question.
Thank you.
Okay.
All right, we had a couple of other questions, and one of those was about the difference, and Drew, this might be a great one for you, is the difference between a multiple sclerosis type tremor and an essential tremor. So there's many different types of tremors, but there was an individual who expressed that she had been diagnosed with MS for many, many years, and she wanted to know, what's her tremor from MS or was her tremor from ET? And so
Good. Yeah, so that's a really interesting question. So MS can affect a variety of locations in the nervous system. And very typically with MS, we'll see symptoms that come and go because things are changing in the system. So you'll get the lesions that are typical of MS being located in different parts of the nervous system. So a tremor that's associated with MS is probably going to be a little bit different than essential tremor, in that it depends on where your MS might be affecting your nervous system. So the characteristics of that tremor may be different, but usually with MS, you also get this waxing and waning of the symptoms. You're going to have times when if tremor is part of your MS, you'll probably get times where it's bad and other times where it's not so bad. Whereas essential tremor usually has some very distinct characteristics. So those of us that live with it, it's very common to have what we call intention tremor. And that means when you're moving your hand with intention, like you're pointing at something, or you're grabbing a pen or a pencil, or you're bringing a cup to your mouth, that highlights or enhances the tremor. That's very characteristic of essential tremor. Your tremor with the MS may be similar, but it may be very different. So it's kind of a hard question to answer, because your tremor may be very similar if it's located in parts of the brain that would give you that intention tremor. But it could be very different as well.
Well, and you brought up the key between MS and ET, because I've had a couple of friends who had MS, and it's not there all the time necessarily. With ET,
Right.
it's always there.
well, there's different types of MS too. So there's
Right.
remitting, which is one of the most common that you were talking about. There is a progressive MS that it might be there all of the time, but yeah, it's with the most common type of MS, absolutely, that it goes in. So they have spurts, and then they will get worse for a period of a few weeks or months, and then all the symptoms will lighten up for a period of time. So
At least for me, it's always there.
I think that brings up a really good point. In the scientific literature, there's been a movement around essential tremor, in that we shouldn't really diagnose essential tremor until somebody has had that diagnosis or those symptoms for 3 years. And the reason for that is it's very easy to misdiagnose essential tremor. And it's really important to watch the symptoms very closely and very carefully over that period of 3 years to make sure that we're not missing something like MS, or that it's not really a Parkinson's disease, or that it's not something like dystonia. And so it's very common to have essential tremor misdiagnosed. And so now one of the criteria for making the diagnosis is that somebody's had it for 3 years. And so I think that's one of the key messages that we should communicate today, is that people need to make sure they're getting a good diagnosis, that you see a good neurologist that has experience with movement disorders, or you actually see a movement specialist to make sure that your diagnosis is really firm. The reason why that's important is because it changes how those symptoms are treated,
Right?
and it changes the outlook for what your tremor may lead to down the road. So really important to get a good diagnosis.
Drew, I almost wish they'd do that with Parkinson's, because quite frankly, I think more people are misdiagnosed with Parkinson's than, I don't know, ET, it seems like.
Well,
it happens in
Parkinson's.
Well,
I
they've
think
got
it
the
happens
new,
in both cases. There's a little bit more black and white criteria for Parkinson's.
Correct.
And so sometimes it makes it a little bit easier sometimes actually to diagnose. But I've seen patients in my practice that come in with a diagnosis of essential tremor, and I end up sending them to a neurologist because I think they have Parkinson's, and they end up with Parkinson's. So, and I've seen the opposite too. People diagnosed with Parkinson's, and it ends up that, gee, they really have essential tremor.
and that again is one of the things we want to say again, is if you're able to go see a movement disorder doctor, that can help a lot because they're qualified to work with you on Parkinson's, dystonia, or essential tremor. And I agree, that is the best thing we can do, is get the correct diagnosis on what you have, and then treat it. So, and
I think it's important to mention too, that with PD, with Parkinson's, there's imaging studies like a PET study that you can get that's very sensitive for Parkinson's disease. So not a lot of general medicine doctors know to order that if they don't have an expertise. So that's one of the reasons, in addition to the symptomatology, which can be confusing. And then there is a crossover. So some individuals have PD and essential tremor. So
My mother.
yeah, so there is that as well. So I think, we're really looking at what is our end goal here. Our end goal here is to diagnose you properly so that your treatment can be appropriate. And the treatment, so if you have Parkinson's disease, you're going to be taking L-DOPA and other medications, right?
Yep.
If you have dystonia, you're going to be taking very different medicines. If you've got MS, there's very specific meds to treat MS plaques. And then for essential tremor, hopefully many of these currently
Someday.
got a little race going. see who gets the first new medication out that is helpful, that we can treat, as well as some surgical options such as focused ultrasound and deep brain stimulation.
Okay, you brought that up, and that is a big thing of the questions. So you get to discuss the DBS and focus ultrasound to explain. Everybody's wanting, curious about it.
Yeah, so those are both considered surgical procedures, although they're very, very different. So deep brain stimulation requires a actual holes drilled into your skull and little tiny electrodes placed inside the brain. It basically works like a brain pacemaker. So if you could listen, so one of the things we do in surgery is we actually listen to the brain cells, and in essential tremor, they're very erratic, almost like an erratic heartbeat or an arrhythmia, but in the brain. And then when we place the stimulator and turn it on, then the rhythms start becoming very regular. It's very, very cool to see this. So that is how a deep brain stimulator works. It's placed in an area called the thalamus, which is deep inside the brain. Your thalamus is your relay center. So pretty much everything passes through the thalamus from the cortex down to the rest of the body. So those tremor cells are highly active in that area, although they're not only in that area. So a lot of research, and Dr. Drew, you can talk more about this than I can, but also involved in the cerebellum, which is involved in your balance centers, which is why a lot of people have trouble with balance with ET. That wasn't really talked about for a long time. But when we place these deep brain stimulators, it can reduce tremor by 50 to 90% in some cases. Sometimes individuals that have been on medication don't need to be on it. And sometimes those that it hasn't worked for, now their tremor is controlled enough. It's not a cure, but it will significantly improve the tremor, so you can eat, so you can write legibly, and really function at a much easier level. So it does involve an overnight stay in the hospital, but then we send you home pretty quickly, and different centers do it different ways. Some of them put in the brain stimulator and the pacemaker all at once. I tend to do a staged procedure. So I'll put in the brain stimulator, send you home, and then bring you back to have the pacemaker put in. But one of the really cool things about these is you can control them electronically. So you have a little handheld device, you can turn it on, you can turn it off. So a lot of people, these batteries have a battery life, as you can imagine. So a lot of folks will turn them off at night because you're not needing it at night, and then turn it on during the day. So that is deep brain stimulation. Obviously, there's some side effects that we want to talk about. So really important to go to somebody who places a lot of these. All right. Generally, these are done with the patients awake. Very specific indications why it would not be done awake in essential tremor. And it's really not something I do, because I like to know, not only is it working, but are you having side effects? Because listen, this thalamus, it's an important structure, and it's close to areas that control your movement, control sensation in your body, right? And so we want to be sure you're not having difficulty with movement or speech or anything along these lines when we turn on this stimulator. And then there's risks for brain surgery in and of itself, right? You can have bleeding in the brain or infection in the brain. Those are very low risk, but it's something to consider. And so we do a general health profile as well before considering you for that. Now, focused ultrasound, it has a similar effect to deep brain stimulation, except, very importantly, one, you don't need a hole drilled in your head, and two, it makes a permanent lesion in the brain, okay, as opposed to deep brain stimulation that is just a stimulator that can be removed and has not done any long-term brain damage, so to speak. But with focused ultrasound, it is a permanent lesion. It's in the area of the thalamus, and it's done with what it sounds like a very high frequency focused ultrasound machine. It's essentially like it's similar to an MRI CT if you've ever had one of those, right? You go in and in this machine and head frame, and then they place the lesion. They do a test lesion. And that has had some good effects. It's a much newer treatment. One important thing I think to let you know about that is it used to be indicated only for one side of the brain, okay? But as of 2020, now you can, not at the same time, but you can go in and have one side of the brain treated and then have the other side of the brain treated with focused ultrasound. And for somebody that couldn't tolerate a hospital stay, for example, and a full brain surgery, this may be a really good option for you. So, and some of those results have been quite good. So we're still waiting on a lot of the longer term studies about that. But those, brief.
One thing, Darlene, we want to let everybody know, and after the new year, we are going to do another ET Talks
Mhm.
just on DBS and focus ultrasound.
Yes.
Right.
And so we want everybody to, join us then, so that we will be having, like Insight Tech and Darlene on to debate about which,
Right.
what's going on with it. So you will be able to ask your questions, and we're getting that planned. So, keep up
Right.
with what's going on. So that's going to be fun.
I have
It
a
will be.
question, Darlene.
Yes.
Regardless of the procedure, neither one of those will stop the progression, correct?
That is correct. Yes. And that brings us to one of the questions that's in
I
the
saw
chat,
that.
which is perfect. So the question is, does ET always progress? So, here's the situation. When we can't identify the specific cause, it's difficult to follow it precisely. However, what we've seen in longitudinal studies is that essential tremor does tend to progress over time. The speed with which it progresses is very different from one person to the next.
Yep, it
Okay,
is.
I think that's very important to understand. And then familially, so when it's passed down through the generations, if you have essential tremor, your child will probably get essential tremor at an earlier age than your symptoms first showed up, and tends to be more severe. Now, that's not a blanket statement, but
Yeah.
it is very common that we see that. So I think that's important to talk about. But
That's it.
Yeah, there's been a lot of really good work over the last probably 10 years, where there's a brain bank for essential tremor. So, for example, if you have essential tremor, you can donate your brain to this brain bank when you die. And
Yep.
what that's enabled researchers to do is look at these brains. And what we're finding through those studies is that essential tremor is a neurodegenerative process. So
Yep.
when we go in and look at those brains, what they're finding is that there's certain parts of the cerebellum, the back bottom part of the brain, that are actually degenerating.
Wow.
And so it's a degenerative process. And I think that's really key, because we can start to look at other degenerative processes and start to look at things that maybe we can do as patients to take better care of our brains,
Yep.
so that they don't degenerate as quickly. So I think it's really important that you eat the right food, that you avoid toxins, that you avoid bonking your head, right? Anything that's going to cause further degeneration, we want to avoid, and anything that's been shown to help neurodegeneration is something that we should consider doing. So that research, I think, has been really key and really important, because many of you, like me, were told you have benign essential tremor, right? Well, it's not benign. It's a neurodegenerative process. We're seeing that it's associated with other neurological problems. And so it's really important. I think my big message that I like to get out is, one, it's not benign. And two, there's other things that we can do to take care of our brain to help slow down that progression over time.
Interesting you brought that up, Drew, because I'm actually part of that study and have been for 8 years.
Cool.
In fact, I have my next meeting with them next Tuesday.
That's awesome.
And it's interesting because every time I see them, it's basically either 2 4 hours or an 8-hour day. And I always do the 8-hour. I go through a complete neuropsych test every time. And then they do movement videos, you know, and it's feels kind of good to be part of it. And people looked at me weird when I said that I was donating my brain. I said, what am I going to do with it? You know, when I'm gone, yeah, okay. But yeah, so it's been very interesting to be part of that study. And I signed up right after I met you, Diann, if you remember.
Yes, you did.
Mm-hmm.
And I'm like Dr. Drew, I'm really excited that they're looking into this and doing more research.
Yep.
Because there is more into ET. Dr. Drew, we talked about this on the last meeting. People think of ET as the symptoms, as just being the tremors, mainly the hands. But there is more to ET. And we need all the research. We need NIH and the top research doctors to keep pushing this, because the cerebellum, I said it, is involved. And there's so much that needs to be done to find out what's going on with the brain and with the central tremor. And I'm really happy to hear all this information coming out, because we need this instead of just being tremors.
Just in the last 7 years, Diann, we went from being told, no, it doesn't affect your balance. That was a
Right.
biggie.
Right,
To nothing about the cerebellum. It was all thalamus.
right.
To other things too. They're wondering, does it affect cognition? I don't think they really know for sure yet.
Well, there is studies now.
There's really good studies showing that there's associated cognitive decline with essential tremor. So yeah, and there's been associations with dementia as well. So
Yep.
there's increased incidence of dementia and Alzheimer's with essential tremor. So really the take-home message is we need to take care of our brains.
Yes.
Yes.
Yeah.
And
Yeah,
there
we need to realize this comes from the brain. People think of it as just a movement disorder, but this comes from the brain.
Yeah. One of the things that's interesting to me when looking at deep brain stimulation versus ultrasound, there's been a couple articles that have come out that are looking at deep brain stimulation as possibly a mode that's helping the brain to change.
Mm-hmm.
And so one of the things that we know about the brain is that there's something called neuroplasticity. And that means that the brain can change. That means that you and I can change how our brain functions. And there's a little bit of evidence that maybe deep brain stimulation might play a little bit of role in enhancing that neuroplasticity. So if I were, today, if I had to choose between the two, I would definitely choose the deep brain stimulation, because I don't want those permanent lesions, right?
Yeah.
And the possibility of having some plasticity or the ability to change my brain a little bit is really intriguing to me. So that's just one of my thoughts on some of the stuff that I've been reading.
Well, it's interesting you say that, Drew, because I went to a conference, gosh, when my mom was considering DBS, which was how many years ago now? And it was from a gentleman at the Medical College of Wisconsin. Frater, he's been doing DBS surgery since the 90s. And so he's done quite a few. But what they were saying in the conference is that they were also looking at using DBS for patients that were severely depressed and, you know, a lot of other things, like you said, besides just essential tremor.
Oh, yeah. And I'm sure Dr. Lobel can speak to this, that, you know, it's being used for lots of different things.
Yes, in addition to movement disorders, so treatment of ET, Parkinson's disease, and even dystonia, there are some studies that with chronic pain, with depression, even obesity. So a lot of different indications for DBS, and even it's not technically DBS, but there is a similar treatment for epilepsy if they can find a particular focus that cannot be easily resected, for example. So
There's your plasticity, Drew.
Yeah.
yeah, and it's interesting too. And I know we're not supposed to hijack and talk all about DBS, but I you know, the latest stimulators, a lot of them are studying responsive neurostimulation. So not just this continual, let's just deliver a pulse, deliver a pulse, deliver a pulse, but when the brain needs it, and learning to identify when your brain does need it. And I think that really goes hand in hand with neuroplasticity, because I believe the brain can learn. Obviously, it changes, it grows on a regular basis as we give it opportunity to do so. So I'm very excited about some of those newer technologies. So
We're not
Yeah.
really hijacking the conversation, but those are the biggest questions we get. Focused ultrasound and DBS, right, Diane?
Yeah, it is. That's it.
I know there have been some studies as well at looking at new locations to place the deep brain stimulators. They're looking at some cerebellar nuclei where they think that, you know, maybe placing those in the cerebellum might be beneficial for essential tremor. So that's something that some people are starting to look into.
I would imagine it's kind of hard to get test subjects for some of this and get approvals to do some of it.
Well,
yeah,
they
usually get
start
compensated.
with mice, right?
yeah,
Yeah, there
they
you go.
start with different animals first, for better or worse, but at any rate, it is tested. The safety and efficacy is tested many times. And you know, the other thing I'll say about that, you know, as a neurosurgeon, I've been pretty much anywhere in the brain there is to go. So there's always a way to get somewhere safely. So even if the actual process of, well, we've never put a deep brain stimulator in that location. Well, I'll tell you what, I've put a needle to get a biopsy for a tumor in that location.
You're right.
I assure you. So there's ways to do that safely. And I think that's an important thing to remember. So
Sure, but it's just the
That's it.
thought.
you're
You know.
right. 100%. 100%. Yeah.
That's it. Okay, let's see, is there any other questions? Um,
I saw one about the Cala Trio device.
Oh, yeah,
Yeah,
yes.
so that's a device that it's a wearable actually,
Mhm.
and it's custom created for you. You can only use it on one side of the body, and it's usually the side with the worst tremor, which in some people is not necessarily your dominant hand. So that gets frustrating, I know, for some folks. But it's actually designed to kind of layman's terms, counterbalance your tremor is essentially what it does. So it's a lot more technical than that, but that's essentially what it's doing. And, you know, there's been some good success with some folks. I know that there's some access issues. Not all insurances are open to covering this, and it is an expensive device. So I know we've
Right.
run into that with our patient group. I know we're trying to work. I know, Diann, you've put together this wonderful patient advocacy group, and that's one of the things we're working on is ways to
That's it.
facilitate this. And when we get the the lingo to give to the insurance companies to help get some of these things approved, that's things that we can share with you as well. So,
And there's other devices out there too.
Absolutely.
And there's a list on the website that you can go to and check out what devices might work for you better. And if you have any questions about that, just contact us. And we're in contact with all the device companies, and we can work with what goes on. And like you said, the insurance, I want to say that the focus ultrasound now is covered
It
by
wasn't.
the Medicare, and like Humana has joined in now. So, you know, that's another thing. And we have more information going on with insurance about, because that's a big deal. I'm sorry, it's the way of life now that you have to choose sometimes what you need to do by insurance
Or what you can do.
and Medicare. So,
yeah, and there's not a lot of people out there advocating for you. I mean, I don't know if anyone's recently tried to go to a pharmacy and get a medicine fulfilled that is not on formulary, but you know, there's not a lot of people advocating for you, but we are here to advocate for you, and that's what
that's right.
really
And we have our family assistance program that is working to do that. We're getting that up and running more. We're adding more
Revamping it,
information.
basically.
We've got more information on that and who to contact and what we need to do. So
we have a couple questions that came through in the
Yeah.
Q&A and then the chat. I do want to address. I'm not sure I have answers for one of them. Dr. Drew, you might know the answer to this. Stephen asked, what form of cannabis is being considered as a treatment? Is it pill? Is it oil? Is it gel? Is it traditional smoking? What is that?
Yeah, good question. I don't know the details of that study, so I don't know how they're delivering the cannabis. Yeah, I just don't know the answer to that question. It's a good question.
It is. I know that some of the, I don't know related to ET, but I know some of the latest research that cannabis gel is being used to treat PTSD symptoms. So I'm wondering if that might be, they've got a really pretty good vehicle delivery system for that. And it seems
How
to
do
be
they deliver that if it's
a
gel?
gel. It gets rubbed into different, you know, usually the back of the neck for PTSD. I'm not sure
Oh, okay.
where that would be,
mhm.
but yeah, that would be interesting.
You know what's going to be hard with that, though?
Mhm.
We have too many states in this country that do not even allow medical cannabis.
Yeah. That's changing. It is changing.
Yeah.
Yes, it is. Things are
Changing.
changing a lot.
Yeah, which is good news.
Yes. So
And this is like with Drew, the next one, Darlene. I see this one. I don't see them all sometimes. This is about your diet.
Yep.
And we do have in February, I want you to keep up with what's going on because February is our healthy eating. And as Dr. Drew said, you know, the diet and keeping your brain healthy. So keep up with that. It does matter what you eat and what you do. Again, I send everybody to the website. We do have links and information about diet, exercise, and everything. And that is how you keep your brain healthy. So
absolutely. And we will have hopefully our chef.
yes.
We haven't confirmed that, but hopefully we will have her back, which is wonderful. But just a little tidbit for you, since you asked the question, Jacob, the Mediterranean diet has been shown in studies to help alleviate some of the symptoms of ET. So that'll get you started a little bit. One other question that we had from Stephen. So it was mentioned that people can have both ET and Parkinson. Is it also possible that ET can be combined with MS or dystonia in a person? So good question with that. And, you know, in my experience, yes, there is some crossover in those. I don't think it's as common as what we see with ET and PD. That is a lot more common, but I personally have seen patients with dystonia and ET. I've seen them with dystonia and Parkinson's disease. I don't know that I may have seen one person with MS and ET. I think that's a lot less common, but it is absolutely possible. But Dr. Drew, you probably see more of these than I do.
Well, the studies show that there's increased incidence of dystonia with essential tremor. So that's a biggie.
Yeah.
The Parkinson's disease, as you mentioned, is a biggie. So those are really biggies and pretty common, I would say. And again, I haven't seen in the studies that there's increased incidence of MS with essential tremor. It's not to say that someone with essential tremor couldn't get both things, right?
Right.
But yeah, as far as the studies go, dystonia is a biggie, Parkinson's disease, and then we're seeing other things like dementia, the balance disorders, hearing problems,
Vision too,
with
aren't there?
speech. What?
Vision.
I don't know.
If
I
there's
know
vision, I know
hearing
speech.
is a big one.
Yeah. Yeah.
Right.
I have a question for Dr. Drew. What kind of a diet do you follow? Because I know you take good care of yourself.
So diet is like, we could spend a whole nother thing talking about that, right? But
Another one.
February. February.
the Mediterranean diet is a good baseline to go from.
Okay.
And you know, when you start looking at all of the literature and trying to figure out what's going to be the best diet for essential tremor, there's nothing specific. And so you have to kind of work your way backwards. So I'll just give one example. There's one of the ways that we study, or the researchers study, essential tremor is they give a substance called harmane to mice, which gives them tremors.
Okay.
They can then study different medicines and other things to see if it improves the tremor. Well, harmane is found in all kinds of food.
Oh,
So it would make sense for us as people with tremor to avoid foods that are high in harmane to reduce the potential, bad outcome of having the harmane augment or amplify our tremor. So some of those, the most common ones that are high in harmane are meats that are cooked at high temperature. And so that would be something to try to avoid. But other places where we find harmane are things like, we can see it in roasted coffee, other foods that are cooked at really high temperatures. And then we also know in the literature that alcohol, for example, over time makes a tremor worse, even though we can drink it temporarily and see a benefit. Over time, it makes it worse. So avoiding alcohol, we know sugar's not good for the brain, but we could go on and on and on. But that harmane is one example of taking something kind of in a different part of the research and saying, gee, if they're giving that to cause tremor, maybe it makes sense that I shouldn't have that in my diet.
yeah.
It does make sense.
Well,
Okay.
that's a great ET talk, because that's the thing, is there are so many crazy diets out there, that
Right.
trying to figure out what works for you, and it might not work for somebody too. We don't know that. I have another question I just thought of. There are a lot of people, and I've run into them, that have tremors because of tardive dyskinesia, because of medication. And sometimes I don't think some of the doctors, and it's not on purpose or whatever, pay attention enough to what the other medications people are taking. And it's caused problems. You know,
It
Well,
does.
there's lots of medicines that do cause tremor. And so really sitting down with your physician and reviewing your medicine list would be another wise thing to do. You know, antidepressants for a lot of people can actually amplify tremor.
Yes.
So, and there's other medicines that can do that as well. So sitting down with your doctor and seeing if there's other medicines or other choices that can be made to help your tremor is a good thing to do.
Always take a list to your doctor ahead of time.
Yes.
So, okay, are we going to have a question? Are you bringing people on, or are they
I'm gonna invite everyone up now as
Okay.
panelists, so you can choose to join us for a little family time. You can also choose to decline the invitation. There's no penalty for declining. So, but we will make that offer available.
for Randy. Oh, he's joining.
He said yes, thank goodness, finally. And we can also, while people are joining, Diann, do you want to mention what we have? I know you've sort of alluded to what's coming up, but I know we've got another ET talk actually next Friday.
That's it. You're
yeah.
saying it.
Okay, so
Yeah.
You want to share about that a little bit?
Okay. Well, we have next Friday at the same time. We're going to have Julie Wooden. She is a dancer, and she works with like the Muhammad Ali Foundation for PD. And she is going to do a series for us of moving like Tai Chi, moving the chi. So she does all these fun things, and she energizes you, and anybody can do these. It doesn't matter your age. You can be very young or older. You can have ET. But she is going to be on to discuss what these sessions she's going to do. And she is just so much fun. She does one with laughter. She does. That gets me going already. So it's just going to be fun. So please join us. And then December, we have another one that we are going to be doing that's real big. And that is our ET Happy Holidays. And that is our Happy Holidays giveaway. Darlene and I are coming up with all kinds of giveaways. Her books, my books, and fun time. It's going to be a fun time. December the 16th. And that's a Saturday.
Yes, it's a Saturday. That way we were sure that everyone could come and enjoy, and we don't have to be so time restricted. So it'll be
no, this is just going to be fun. And during the ET Talks, anybody that registers and that is on with us, we're going to do drawings and we'll win gifts. There's going to be all kinds of gifts. So we want to build that up. And we are also starting our fundraiser. Have to put that in there. So our fundraiser is going to be beginning November the 1st. And it is the Happy Holidays fundraiser. Hope begins with you. So remember to keep all this going, to keep more momentum about essential tremor, we do need funds. We do need donations. And it's a sad thing that has to come up, but we need to keep our programs going. And we are growing so huge, and we want everybody to be involved. And so please join us on our Happy Holidays, Hope Begins With You fundraiser till the end of the year. And then we have more things going. And be counted for ET. One more thing, be counted for ET, because The only way to make a difference for everybody with essential tremor is to be counted, to have united, stand strong. And that is what's happening. So go to our website, DiannShaddoxFoundation.org, and scroll through and keep up so I don't have to keep talking. So is there more questions?
Yeah. Or you guys can also share if you have a story that you want to share about your life or experience with essential tremor. Feel free to do that too. We're going to be featuring some more stories. That's another thing. So
Yes.
during March ET Awareness Month, I often do interviews and then we'll post those. So we'll be doing some more of those coming up. So be on the lookout for that sign up. But if anybody wants to share anything or any thoughts you have on the content from today or ideas like you would love to hear for future ET Talks, now is your opportunity to share.
Yeah. Okay, everybody. Let me say hi. I know a lot of you guys, so.
Yeah.
So do you have any questions? You've got a chance to ask two great doctors questions about ET.
I'll say it's interesting. My name's Brent Benz. I just recently found out about the organization and trying to get involved. But I even, I'm from Little Rock, Arkansas. They did not have a movement disorder clinic. I now go to one at Vanderbilt, live in Nashville. And I think it's just been interesting over the years because it will take a year to get an appointment to check up for it. And then I swear I spend a longer time walking to the room than the appointment takes. It's like, they do the draw of the circles, counterclockwise, clockwise, touch your nose, all that, move your feet up. But then it just seems like the same thing every single time and it's done. So I really appreciate kind of having this information, source of information, just because most of this stuff that I learned today, I've asked about and haven't really had a lot of information on. So
Brent, can I share something with you?
go for it.
I don't know if they still have it. I mean, it's been a number of years ago, but my mother had deep brain stimulation surgery at UAMS.
Oh, very familiar. I have friends who are doctors there.
Yes, well, they've got a tremendous movement disorder group there.
I did not know that.
Yep. So you might want to check it out.
Yeah.
little closer than right.
Well, Brent, I'm glad to have you joining us, and Brent is part of our patient council board. So he's going to be joining us and he's going to help us. We've got to get all we can get of people telling us, like he just said, what he goes through with the doctors. So we appreciate that. And glad to have you on board. And of course, Stephen, no. Does anybody else have any questions? And I want to say hi real quick to everybody who is watching on our worldwide group, Essential Tremor Worldwide Facebook group. And please join us so you can have a voice and talk about what's going on.
Yes,
So,
absolutely. And I have to mention this comment from Shri. He said, very much enjoyed the fun conversational nature of the discussion, different from typical webinars. Well, that's what we like to do.
Yep.
Definitely. No reason you can't enjoy yourself while you're learning something. And actually, it's much better for your brain if you are enjoying yourself. So it gets the right neurochemical balance to be able to learn. So little tip.
that's it. That's it. And we're going to do. We have a lot of these ET talks, and everybody can join and relax and talk about whatever they want to talk about. And whatever you say, don't worry about your tremors. If you're on and you're tremoring and everything, don't worry about it. We all tremor. We're going to tremor together.
Well, and it's nice to be on a talk where somebody's not just reading you a PowerPoint.
Right.
Appreciate that so much.
I've never done that, Cher. Okay. Anyway, on another note, Jacob, do you have a question?
Hey, everybody. I just wanted to say like how thrilled I am to learn more about this foundation and see that there's a focus on overall health and lifestyle that can help with just managing your health. And just because there's not really a lot of information about that out there. But I think that's so important. And I've seen a lot of great changes in my health just from focusing on like diet and exercise. I'm a volunteer for the International Essential Tremor Foundation, and I run a support group with them. And we were talking about reading one of your books, Diann, as a group, so we could talk about it in the support group.
A
Wow.
faded cottage. That is going to be one of the giveaways. We're going to be giving those away in December. That is what
Oh, great.
that's what led me here. That's why I'm here, is a faded cottage. And as a matter of fact, a faded cottage birthday is December the 18th is when I wrote that book. And that's my birthday.
I was just gonna say that's your birthday too.
But that's the birthday, and we'll celebrate a faded cottage. That's really led us here. And it's amazing how many people have joined us. And I can't wait to have happy holidays. I love Christmas. So thank you, everybody, for joining us.
Yeah, Dr.
Oh,
Drew.
Darlene? Yeah.
Dr. Drew, thank you very much for being here today. And Darlene, it's always a pleasure. Always, Madam President.
You're welcome. Glad to be here.
Chair, we appreciate your input.
Thank you.
Stephen, thank you for being here today. Brent, good to have you aboard.
Well, we appreciate everybody being here.
Janet too.
Yes, and the
Yes.
folks that are in the attendee list who did not want to come up, we appreciate
I
you being here as well. So
That's
Bye.
okay.
absolutely, always a choice. So, all right, well, mark your calendars, everyone, for, oh, Stephen, you have one more question. Okay, go ahead.
Actually, I just wanted to apologize publicly for missing the first patient council meeting.
No
I
need.
was having a cognitive moment that day. And I thought it was in the afternoon, not the morning. So I look forward to our next
There'll be
meeting.
more.
Yes,
And,
we're gonna have plenty.
And I have definitely benefited from being part of this community, and thank Dr. Darlene, Dr. Drew, Diann for making this all possible. And I've been doing a lot better lately. I started acupuncture in
Wow.
my neurologist gave me a prescription for that, and I talked to Medicare and they will cover it. So
Your
Nice.
voice sounds better.
thank you. Thank you. I feel better.
Yeah.
And,
Great.
I'm singing better in the choir.
Yay.
So
Good for you. great.
I'm making progress, and it's all because of this group. So thank you.
Aw.
And I look forward to continuing to participate. And I do believe laughter is the best medicine
Yeah,
with this condition. So
You'll have
it's-
to join us for our
The
Uh,
laughter session.
Julie.
that'll be
Yeah,
awesome.
Julie.
Yes, next Friday.
Julie's fun.
Awesome. Thank you very much. I don't want
Thank
to.
you.
Thank you. Janet, you had a question.
I actually wanted to just say hello to everybody here and those listening, and to just share a little bit. You asked if anybody wanted to share a little bit.
Yeah.
I am 69 years old, and I noticed my tremor at 18, and nobody else I knew nobody else who shook. Their hand shook. And by the time I was in my early 20s, a doctor told me, as Dr. Drew said, I had benign essential tremor. And I thought, okay, benign. Okay, so I don't have to worry about that. And I told nobody. I didn't even say anything to my parents. I told nobody. It was benign. So I just left it at that. But being, in my early 20s, I was certainly very, very sensitive about shaking.
Yeah.
So I spent a very, very long part of my younger life trying to hide it, as many other people, I sure can identify with that.
Oh, boy.
And, later on in life, probably into my 50s, I came to understand that this is who I am. And it's only been in the last few years that I've seen it progress. So the doctor that I have been going to for many years has said, you're very fortunate. You spent like 45 years with your essential tremor being pretty much stable, which has been true, but it has progressed now. So it's a different existence for me. But I want to share with you that I have heard things today that I've never heard before. And I've done a lot of research and I've done a lot of probing with doctors over the years. And I have to say, there are many times I've been confronted by doctors and other medical professionals who didn't know what essential tremor was. And I looked at them and said, excuse me, I will tell you what essential tremor is. So I spent a lot of my life trying to also educate people.
Thank
In
you.
the medical profession and not in the medical profession. And I've also felt my heart goes out to the young people, the children. And I also make sure to tell people that I got essential tremor when I was 18 years old, because people look at me now and think, oh, you're old. Old people get this.
Right.
They just think old people shake. And I go, no, I was 18 years old. I even tell doctors now, I was 18 years old when I first got essential tremor. And they look at me like, really? Yes, really. Yes, really. But I've been involved with the International Essential Tremor Foundation for many, 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 many years. And it's the young people that really get to me. I mean, there are infants even that are born with essential tremor.
Yep.
And I have found what has been very helpful for me over the last several years has been meditation, mindfulness, breathing, really concentrating and focusing on breath work. And I'm so happy about learning about this foundation. I learned through Jacob about it. I'm so happy about learning about it. And I want to thank everybody here. This has really been so helpful to me. And I look forward to joining you again. So thank you. Thank you so much.
Thank you, Janet.
Thank you for sharing your story. My goodness, that is touching our hearts. And thank you for being here and being part of this community. It's beautiful to have you.
Thank you.
And your story is so similar to mine. It makes me want to say maybe we need to do a campaign where everybody puts up a picture of what they look like when they were diagnosed.
Yeah, there you go.
This is what I look like, because I was like you. I was in my early 20s when I was diagnosed, not when I first started tremoring. And I do the same thing. I was young. So
Janet, I don't know if you can see it. I have a medical alert bracelet that says essential tremor on it. And honestly, it saved my life about 4 years ago. Because I had got stricken with very severe influenza A. And they understood that my shaking, because when I get sick, it triples. Okay.
Everybody, yes.
Yeah, everybody does. But they understood I wasn't drunk and I wasn't an addict. And so they gave me the medications I needed.
Well,
I would
everybody,
recommend- I also can't walk a straight line. If I ever get pulled over, I discovered that when I started the research project. I didn't know I couldn't walk a straight line. So
I don't
this
think
is,
any
I
can.
think, important, yeah, for
Yeah.
anybody that's got E ET.
Well, everybody, this has been so much fun. And we appreciate all your stories and we appreciate you joining us. We are working. We are going to make a difference. This is my life, is to bring essential tremor to the world. And my goal and my vision is becoming a reality. And please join us on all the ET Talks. And again, I'm going to push the website. Please check it out and keep up with us. Send messages, contact us. So everybody, we'll see you again next Friday.
Same time.
And y'all come back now, you hear?
That's right.
That's it.
Diann,
See you.
Diann, you may want
Yes.
to tell Janet about the kids we have on our website.
No kidding.
Yes, that is one of our programs, is our Children Initiative, Educational Initiative Program. And bullying, that's another program.
Yes.
So really dig through, you will see all our programs and, what we stand for and what we're doing. So I guess that's it. Okay, we will see everybody and we're going to have fun again. Julie is fun, so really.
Looking forward to it.
Okay.
Good
Thank
seeing
you
you
for joining
guys.
us.
Good seeing you too.